Dear students, welcome to Spot the Spotters, the key to success. These topics appear small, do not accumulate. They shall become a heavy load towards the examination. This diagram is for a quick recapitulation of today's topic. I am able to see a diagram of the heart with the ventricles over here, the interventricular septum, the aorta, arch of the aorta, and the pulmonary artery. Here I am seeing the superior vena cava. So this is important for us. As I have been mentioning always, measurements are mandatory. Whatever be your specimen, you will have to first measure. This is a part specimen of the heart. This is not a whole heart, a part specimen of the heart. In fact, you can mention it as a mounted specimen. I am able to see the left ventricle over here. This is the anterior, the posterior, the lateral side of it, and the interventricular septum. You find that there is a marked increase in the thickness of the left ventricle, which is uniform throughout. Naturally, the left ventricular lumen is reduced. The right ventricle, on the contrary, is unremarkable. We can mention the measurements of both the left ventricle and the right ventricular wall. Obviously, the diagnosis is hypertrophy left ventricle. This is the same diagram, and this particular sketch you people can draw in your records. So there is a left ventricular hypertrophy, a compromise in the lumen. The hypertrophy is uniform throughout. The right ventricle is unaffected. Now, there are two types of hypertrophy. One is called the concentric hypertrophy. Concentric means circle outside the circle, and they are all parallelly arranged. Whereas there is another type called eccentric. Eccentric means out of the central point. So you find if this is going to be the lumen, there is an unequal thickening of the wall. This is called as eccentric hypertrophy. Both are probable. A hypertrophy can occur in the case of valvular stenosis. Aortic stenosis, for example, can lead to left ventricular hypertrophy. Valvular incompetence, both aortic as well as mitral valvular incompetence can lead to a hypertrophy. Hypertension, because of the increased pressure overload. These are some of the causes for hypertrophy. And this is the myocardium. A normal myocardium, I am able to see the nuclei over here. They are all viable. And this is a hypertrophy. Compared with this, I find that there is a marked thickening of the myocardial fibers. Striations can be made out. The nucleus is slightly eccentric in position. So this is a case of hypertrophy, an increase in the size of the cell, but not in the number. Hyperplasia means there will be an increase in the number. Therefore, the specimen for us will be cardiac hypertrophy, specifically left ventricular hypertrophy. And these are the sources of reference: R.A.T.S, GAME, TIPS, and Roberts. To syntax.